recording and questions. So could you please state your name and your career?
My name is Dr. Nicole Lee Plenty, and I am a double board certified OB/GYN and maternal fetal medicine specialist.
So what does an average day look like for you as a doctor?
So on a day-to-day, I usually go in around 7 and I go and round on consults in the hospital if I have any. And then after that, I go to clinic and I'm usually seeing anywhere from 15 to 28 to 30 patients a day. In the hospital, I'm seeing only high-risk patients, so patients that have a history of like blood clots in their lungs, people that could have high blood pressure issues in pregnancy, people that could have cancer in pregnancy. Anybody that's in the ICU in pregnancy, I would be consulted on to see them because they are considered high risk. In clinic, 80% of what I do is ultrasound diagnosis of fetal anomalies. So I am constantly looking for brain defects, heart defects in babies to make sure that those areas of the entire baby are completely normal structurally. And if they're not, then we're doing things to plan for the baby after delivery. So I do ultrasounds and then coordinate care between different subspecialists within pediatrics after delivery. I also do a lot of preconception consults. So talking to women that want to get pregnant about fertility issues or ways they can optimize their health so they can successfully have pregnancies without complications. Sometimes I may do C-sections. Sometimes I may do what's called cerclages, which are procedures that basically where I go in and if somebody started preterm, like dilating prematurely, and they don't have any pain, so they have painless cervical dilation, I'll go in and basically put a purse string stitch to cinch the cervix back closed. Both of those procedures are what I do most commonly in the hospital. Outpatient, I would do amniocentesis and genetic testing for confirmation of chromosomal abnormalities would be the most common procedure I do in office.
So what do you love most about your job?
I love everything. I feel like maternal fetal medicine is like really the best field. It's not for everybody, but I feel like it really could be. It is OB/GYN, so I had to do training in OB/GYN and then subspecialize in maternal fetal medicine. So OB is like probably one of the most flexible career paths. Like it's the only path that you can decide, like, I don't want to deliver any more babies and only do gynecologic care or wellness visits and still make a decent living. Or if you don't want to do any GYN, you can just do all obstetric care and just do deliveries. You can only be a hospitalist, meaning you have no clinic, you only doing deliveries in the hospital. Or you can only do clinic and not have to deliver. Or you can choose to subspecialize like I did and do maternal fetal medicine, GYN oncology, or reproductive endocrinology and infertility. And then you specialize in those concentrated little areas. And so I love the fact that for me, I'm dealing with a lot of patients that are like the cool stuff, right? Like the high risk stuff in pregnancy. So it's sort of like being paid to think and figure out how to get this mom safely through the pregnancy, which is very rewarding when you get them safely through. So I love all aspects of my job, to be perfectly honest. I don't think there's anything that I don't like about my job, except for probably charting. And I don't like really charting because our system is also antiquated. But other than like the actual like administrative part of it, I love the practice of MFM.
And when did you decide to become a doctor?
So initially I thought I wanted to be an attorney. I had this legislative scholarship for undergrad that would have supported me going to Tulane. And then I got nominated for the National Youth Leadership Forum on Medicine and went to LA and did the program for a couple weeks, met some counselors and loved it. Like I loved, visiting the medical schools around California and the LA area. I loved hanging out and talking to medical students about their experiences. Our counselors were medical students. They shared their experiences. And I was like, yeah, I want to do this. And so that was the first time I was like, you know what, I really want to do this over here and not do law. And then once I got into not medical school, once I went to undergrad, I had a cousin that passed away from complications of preeclampsia, which is when women in pregnancy can get high blood pressure and vascular damage. And they look at that vascular damage as protein in the urine. So my cousin died from severe complications of that at age 23, young, healthy, thin, no medical problems before. And I wanted to figure out like how this happened. And so then I started doing research with someone from Tulane about preterm deliveries and preeclampsia, and that sort of sealed it for me. I wanted to help women get safely through their pregnancies. I wanted to work with people that were more at risk. And so I never really looked back from that point.
So just like talking about your journey to becoming a doctor, what did you do in high school, like activities, classes, sports?
Oh man, high school is like the best time ever, right? Like if you don't like high school, like turn around, do a 360 and like enjoy it. I did almost everything. Like I was very involved in high school. I was SGA president. I was like a class officer all 4 years. I was a varsity cheerleader. I was homecoming queen. I was on Valentine's court. I was prom queen. I mean, I did a lot of stuff in high school. I did juniorettes. I did volunteering. I mean, you name it. I was in, I think, about 16 different organizations in high school. So I would say I was very active. None of the things that I did were like really like, boom, this is what, consistent with medicine. Like nothing I did was consistent with medicine, but I do think that it helped shape who I was. Because of those volunteer experiences, I began to, I could empathize with people. Even now, I could remember when I volunteered at nursing homes. And so now we have this pandemic and it's affecting all the nursing homes. It makes you empathetic to what's going on. Having done a whole bunch of things in terms of like counseling and drug abuse counseling and working as at BoCare, which is a United Way agency with like lower income students and things like that. I can empathize with people having financial barriers. I was from a low socioeconomic area as well. So I can identify with all those and empathize with all those patients. And it also gave me the work ethic that I needed, right? Because if you are a cheerleader and you needed a sign done, it was like, we got 20 minutes to do this sign. And so you're like getting it together really quick. So it definitely made me be able to like juggle and balance everything. And that's starting from high school. Like, so once I got to college, juggling college and, being on SGA and being, a college queen and things like that, it was just like, I can do this. I mean, I did 5 times as much in high school, so surely I can do these couple of things. So it just shaped who I am.
And then now talking about college, what did you major in college?
So I majored in biology and minored in chemistry.
So I know that with like the pre-med track, you can major in anything you choose, but why did you specifically choose biology and chemistry?
So for our college, so I went to Xavier University of Louisiana, which is in New Orleans. And if you were pre-med, you had to fulfill a certain amount of classes. So most people went into biology, chemistry, psychiatry, or biochemistry as their pre-med majors. Now, you could get into medical school and still take those same courses as long as you have the prereqs and not be pre-med. But at my university, you had to be like majoring in a science to be considered whatever that was pre-med because it went through the science department. I chose to major in biology, honestly, because I went in and I thought I want to be a doctor and I didn't know what I wanted to major in. I was like, okay, I like science, I like math. And I talked to an advisor and she was like, well, what do you think about biology? And I was like, I could fall back on if I didn't get into medical school being a marine biologist. And so for me, in my head, that is why I majored in biology. One, biology is a study of the body, right? It's a study of life. And so I knew that would probably give me more of a foundation to make sure I could finish my prerequisites. But also the fallback was what I was thinking of. But now that I'm thinking about it, I'm like, I don't even like water like that. Like, I don't even like to swim. So to say I was gonna be a back, like my fallback was gonna be marine biology, was like, why did I say that? So luckily, the medical school thing worked out. But a lot of people usually choose a major in a science that's pre-med, but you really don't have to. But if you don't, you really need to make sure that you pull up the American Association of Medical Colleges, so you know what prereqs you have to take, because you cannot get into medical school without making sure you take the prereqs. You can measure in Chinese history for all I care, but you got to have the prereqs to actually get into medical school. And being in the pre-med science curriculum was just a surefire way. Your advisor talking to you about pre-med stuff. All your friends are in the same classes as you are. And so it's not like you have to put any extra effort into finishing those courses, in addition to making sure you finish the load of something that's off topic, to make sure you can graduate with that degree.
Mhm. So what activities / extracurriculars did you do in college? Did you like shadow any doctors, volunteer in any hospitals?
So in college or undergrad?
Like undergrad.
So in undergrad, yeah. So in undergrad, I started doing research in the summer of my freshman year. And I would encourage everybody, like, once you get to college, it's not the time to retake classes in the summer. Like, you need to go into college trying to ace your classes the first time around, so that your summers you can spend time CV building. So majority of my exposure to medicine was in the summer. It wasn't in the school year. It's hard to like shadow and do all these other things while you're trying to focus and make sure your grades are stellar in the school year. So the summertime is where I spent most of my time, like doing research programs. Like, I went to University of Virginia one summer, I went to Brown University one summer, I went to University of Georgia one summer, I went to Tulane one summer. So it's something after each year that I went to, and I gained really good experiences from those program. I gained people that could write me letters of recommendation, and I gained people that are mentors to me even now through some of those summer programs that I went into. So I did shadowing through those programs, and then during the school year, I just focused on my grades and extracurricular activities. And so if I was going to volunteer at a nursing home, I would volunteer at a nursing home. If it was volunteering at a hospital, I would volunteer at a hospital. There wasn't any like one thing that I did that was like, I definitely need to do X, Y, and Z because I want to go to medical school. Like, I didn't do that. I just did volunteer. I volunteered because I wanted to do it. It wasn't necessarily to do one thing or the other. And for medical school applications, that's important, just to make sure you're staying diverse. They don't really care what volunteer activities you do, as long as it's volunteer. And they don't care really what you major in, as long as you have a really good GPA and you have those prerequisites. So for me, no shadowing during the school year. All my stuff was during the summertime.
What did the pre-med track look like in college, and what was preparing for the MCAT and med school like?
So so the pre-med track, I went to Xavier. Xavier is #1 in placing minorities into medical school, and they have been since 1993. And so their track is like very rigorous. Like, we take, we start off the summer before. If you get into Howard Hughes summer research summer program, then you're already taking Chem 1. So you start off taking Chem 2 going into your freshman year, and then Orgo 1, organic chemistry 1, the second half of your freshman year. So you already a leg up based on other colleges. And during that year, we had to write our personal statement and turn it into the medical staff office or the pre-med office. And they would edit it for us. And they wanted us to apply for summer programs by January 1st. And they had a list of them that we had to apply for. So it was a lot of like pushing us to excel and making sure that we're doing something in the summertime. We also, for the first 2 years, had to have our academic advisor sign to say that they had talked to us every single week. So we had to talk to our advisor every week, who had to look over any test grades that we had that dealt with science every week. And in that time, if you made 2 C's in a semester, they would tell you, yeah, you may want to consider another major. So they were very serious in making sure that we stayed on track and we knew how serious it was to make really good grades. And we had 2 C's in undergrad, they would tell us like, this may not be the best thing for you. If you can't keep your grades up now, you won't be able to handle medical school. Yeah, it was sort of strenuous.
Yeah. So how was medical school? And like, in other words, what did it feel like in terms of rigor studying? And did you like
Hard,
it?
hardest thing I've done. Hard. Well, marriage is probably the hardest thing I've done because you have to like figure out somebody else that's not you, and you're making decisions and they're making decisions for you. You're making decisions for them, and you have to figure out how that affects one another. So that's the hardest thing I've done. But medical school was hard. I mean, because you go from being like, I was valedictorian in high school. I graduated with honors in college. And you realize that everyone is at the top, at least the top 10% of their classes in every medical school. And so then you go to be average. And so it's a hard pill to swallow, and it's a lot of information. Like the amount of information I may learn over the course of a semester in med school and in undergrad, I was getting that in a block, a fourth of the year in college. I mean, in medical school. It's just a lot of information that you have to know, and you're constantly reminded, like somebody's life depends on you knowing this information cold. So it's a lot. I mean, it's a lot to devour getting into medical school, and that's why the acceptance rate is very hard. It's very, it's a process to get into medical school, because they want to make sure that it's not anybody that's going to waste their money. Okay, they want you to finish when you start, but you also have to know the information. So medical school was hard. I had a very good class at Tulane. We helped one another. We shared notes. We studied together. And we went from class to the study hall, and we were studying all night long. I mean, we studied a lot. In high school, I didn't have to study. College, I had to study some, but nowhere near as much as I had to study in med school. I mean, it was hard, all worth it, but it was, you got to study. And so if you're somebody like, I don't like to read, med school may not be for you. I mean, I don't like to read just like books at leisure, but I have to read and constantly learn. So I'm used to reading. If you're not somebody that's willing to adjust and you think you're going to get through this without reading, or, that's not going to work.
Mm-hmm. So what did an average day look like in medical school?
Ooh, so average day, I'd wake up, I get to school around 7:30. Med school classes will start at 8. We have like an 8 to 10 med school block, and then a 10 to 12, you take a break, go to lunch, back at it 1 to 3, and then 3 to 4:30, 5 o'clock. And then I would go to the study room with 3 of my other friends, and we would study immediately after class. That was our time. Some people don't do this, but we studied immediately after class. We would review our notes from that day plus the day before. So at the end of the week, we're reviewing the whole week worth. So the time we stayed at school got longer and longer each day because we're reviewing more and more stuff. And then we would read on our own, because there's always stuff on the test that's not covered in lecture, and you have to make sure you're reading the chapters as well as the notes. So we read on our own on the weekends. So our weekends were a lot lighter, whereas some people's weekends were very heavy because they were going home and they may have had families and things like that. I was lucky that I didn't have any family. I was young, single, and I could stay at school from 7 a.m., do classes, like leave class at 4 or 5, and then stay there immediately from class until 9 or 10, and put in 5-6 hours worth of studying a day, because I didn't have a family. I think it was probably more challenging when people did have families in some sense, but it was that was a typical day for me to study. But the weekends were pretty much like, we would read on the weekends, but for the most part, we would go to brunch and hang out. So you could have a life if you put the effort first, which is what we did. We wanted to make sure we at least had a day. Saturdays were usually our day to do nothing except for do whatever we wanted to in New Orleans. And then Sunday, most people would do some reading. I would do reading and review some things, review the syllabus, review what I'm supposed to be, what we're supposed to be covering on Monday, on that Sunday. Now, those are the first 2 years. I'm sorry. Clinically, 3rd and 4th years, you have rotation. So Your rotations, it depends on what rotation you're on. If you're on surgery, you could be getting to the hospital at 4:30 in the morning and not leaving until 7, 8. You know, if there's a case that rolls in 9, 10, I mean, you could be there all day. OB usually starts at 7 and you are getting out, you know, so sign outs at 5. If you're on call, that means you're staying as a medical student overnight in the hospital, but you function as a part of the team. Like you're writing notes, just like the interns writing notes, and you're following up those patients. You go see the patient before anybody else goes to see the patient. And then you report back, like, this is how Miss Jones was doing overnight. This is what happens. She said this, she said that. She has questions about this, that, and the other. And so you sign that off to the residents. And then when you round, the residents sign out to the attendings, or once you're comfortable, you would sign off to the attendings after you ran it by the residents.
So in the 3rd and 4th years of medical school, when you did rotations, did you do rotations for like all different specializations, or did you get to pick one?
3rd and 4th year, you have core rotations. So like 2 months of surgery, 2 months of internal medicine, 2 months of pediatrics, 2 months of OBGYN, 2 months of psych. Like you have those cores. And then you have some required electives, like a month of ER, things like that. And then there are some non-required electives, like 2 weeks of breast surgery, 2 weeks of cancer surgery, 2 weeks of radiation, 2 weeks of, you know, radiation oncology. You know, you can do those like super specialized rotations during your 4th year, but you do have like your core rotations and then your electives. And you don't rotate through all of them, okay? There's too many of them. So let's say I knew I wanted to do OB. I may choose to do a sub-internship my 4th year in just OB, and then I may choose to do an elective in just maternal fetal medicine, which is what I do. But everybody's not doing an MFM rotation. Everybody's not doing breast surgery. They get to choose between obesity medicine or bariatric surgery and breast surgery. You see what I'm saying? So everybody doesn't rotate through every single thing, especially the subspecialized fields. You do rotate through all the core fields.
Mm-hmm. So I know you said before you talked about your cousin, why you went into OBGYN, but like I know you were talking about how in like the 3rd and 4th years of medical school, you're going through like these core specializations and fields. So what made you 100% sure that you wanted to go into OB instead of any other field?
Well, I just I didn't like any other field. So I won't say I didn't like any other field. I didn't like any other field as much as I liked OB. And I say that because the whole reason I went into medicine is because of the complications that I told you about my cousin had. And so I knew I wanted to help women. I wanted to treat women. I wanted to be a woman treating a woman. But once Hurricane Katrina hit, we were whisked from Tulane to Baylor. And so we were Tulane at Baylor for about a year. And during that time, they couldn't tell us when anything was going to open, when the hospitals were going to open, what happened to patients we were normally rotating with. And so that's when I decided to get a master's in public health with a concentration in health systems management. And the advisor there used to be really big in the public health field in California. And he told me, do not go into OB. It's the malpractice rich field. Don't do it, right? And so I said, oh, okay, I'm gonna try to like something else. I remember I was like trying hard to like something else. And I loved everything. I tried to go into every rotation with an open mind, but there was nothing I liked as much as OB. So I was like, I love it. I'm gonna do it.
And then what did residency look like and how did it compare to medical school?
So residency is completely different than medical school. So medical school, you're like, even on rotations, you're taking tests at the end of each block, right? You're taking tests at the end of each block. Residency, you have a test annually, once a year. And residency is a job, so you get paid something. You are the doctor because you finished medical school and you're only doing your field. So you're seeing patients every day and learning how to become an expert in your own field of study. There's no like studying and reading a whole bunch of books and taking tests. You are reading about cases and you're reading about subjects and you're going to presentations and going to lectures on using one half a day or maybe even a whole day a week. But for the most part, it's all clinical care because you're the doctor learning how to doctor. So it's completely different.
Mhm. And then, so do you have one last piece of advice for aspiring doctors?
I would say really think about what you want your life to look like. Like, don't be a doctor because you think they make a lot of money, because you got to realize we got a lot of debt and it's a super high risk field. And if any field of medicine is, if this pandemic hasn't convinced you that, like, that means you don't know what doctors do, because we're seeing COVID people every day. And so we're risking our lives seeing these patients. And so you really have to figure out, like, what do I want to do? Like, do I really want to help people? Because you have to really want to help, because you're gonna run into some people that can be really, really mean and really say some ignorant things to you. And you have to remember your why you're doing this and that your goal is to help people. So I would say that's the first thing I would think, really think about what you want to do. And if that's what you want to do, you decide you want to be pre-med, if you decide you want to go into medicine, like, my God, do it. You can do it as long as that's what you want to do. As long as you're putting forth at 100% effort, you can do it. Even if you've slipped up in your grades, you can adjust, pivot, and get back on track. Anybody can be a doctor. There are doctors that take a non-traditional course and go to college for something completely different and then come back and do their prereqs and then go to med school. So you don't have to have like this straight and narrow course. Even my course, you don't have to have that. You can take time to do whatever you want to do, but if you want to do it, know that you can do it and don't let anybody discourage you from doing it.
Thank you so much for letting me interview you.
You're welcome. You're welcome.